So finally, we're starting our series.
There is not much room for error in medicine. You see, the stakes are high. You're dealing with human lives. So welcome to this series where we're going to be discussing how to navigate your medical practice and life.
It's a tough field, so you might as well do your best.
There is a need to structure our thoughts and to have a clear vision to what it is that we want to do in terms of approaching a patient, not missing important things, and really having the right thoughts and the right mindset. And at the same time, you want to avoid burnout, meaning that you don't want to be overwhelmed at any given point during your work, even in the middle of the night, even when you're on call or tired. And you need to really know how to deal with frustration, with aggression, with lack of support at many given times. Why lack of support? You have chosen the field of medicine. Congratulations, you must have been inspired. And we're quite confident you're a highly achieving person. But if we're talking about concepts of being overwhelmed and shortage and long working hours and high demand, and being expected to perform nonetheless, then there's a chance that there are times when even the support chain that is supposed to give you the proper support, your senior and their senior and so on, might also be really busy. So if you don't know your stuff and you really don't know the clinical pathway to doing one thing or another, you might quickly find yourself overwhelmed. You see, you must love it to do it right, and we believe that you love medicine. And we're here to really give you the tools to continue to love medicine and to kind of mitigate all those difficult times where you don't know what to do by giving you a structure and a way to approach. And we're going to do that through multiple discussions of cases and concepts and experiences that we would like to share with you.
Even if you are a more experienced healthcare provider but want to entertain hearing our experience.
Mind you, that doesn't mean that what is here is the correct thing or that this is a guidance or a curriculum. It is just a clinician's experience and a bunch of advices. Another disclaimer is that the materials here are intended primarily for healthcare providers, and there's no intention to break confidential information even when it comes to case discussions. And of course, there is no material here that will suffice, whether in this video or subsequent videos on this playlist and series, there's no material that will suffice to diagnose. Please see your doctor should you have any signs, symptoms, and issues. And if you believe a material here for you as a physician might help you to diagnose and treat your patients, you also have to go back to the reference and ensure that you're following the right clinical pathways. Medicine is an art of being a healthcare detective. It needs passion. What was intended by my father when he told me this quote is that you have to have a skill set that is so varied to the extent that you have to be able to deal with things that you at first glance might think are not the job of a physician. A physician is a caring friend. A physician is a social worker. A physician is a vigilant detective, and so on. And so the moment your job description requires you to have highly complex skill as well as a multitude of characteristics and duties to be performed, you see, therein lies more chance for possible error or even lack of people to perform said job.
How invested should you be? Speaking of emotions, how invested should you be in your patient's health?
Taking history is an absolute art that is being lost with time, and how to do it right and whether you need to follow the classical history formats is one thing that we will be discussing. In this channel, you'll also find materials needed by residents to structure their experience and their practice, because we need more competent doctors and we need them fast. Remember when we said there is no need for error? It means we need to put systems quickly for juniors to learn all the skills they need as fast as possible so they are as competent as humanly possible. You see, there's a challenge there. Ask the important questions. We're going to attempt to do some of that, and we're going to have you give your input. And we want to deal with things like guidelines, the controversy thereof, how to deal with uncertainty, and when you don't clearly have a diagnosis, and what to do then, and what kind of symptomatic and supportive care you need to give. We need to give a myriad of ideas on how to approach ourselves and to create structure to the way we deal with different cases. And here are, well, we're going to discuss things like how to approach not just the patient, but also the daily work.
Also, work-life balance.
All those things that happen on a daily basis between administrative, collegial, work politics, etc. How to deal with common issues. This channel will include issues such as professionalism, such as your work-related issues that are non-medical, ethical consideration, and boy, oh boy, do we deal with a lot.
Dealing with burnouts and lack of appreciation.
Some of the things we will share on this channel are related to cultural differences and backgrounds.
When to follow a hunch while remaining safe.
And they're going to have things that, well, have not been clearly described, for example, in medical schools, at least not in the past. And nowadays we're seeing this shift towards having clear structure to ethical considerations. And we're also going to be advocates of involving the patients and involving the right people or the right stakeholders from the community. And sometimes you're going to be faced with challenges of making very fast decisions when there's a really complex decision to be made in order to save a patient's life. We will have case discussions for interesting cases, and we will be talking about patient care. Is the standard of current patient care enough? Or should we go above and beyond? And should we implement different personnel and specialties in patient care? Should patient care be confined to the clinic or the hospital, or should it be in the community? And should it be driven directly by a healthcare provider, or should it be driven by the patients themselves? Questions and considerations, ideas and suggestions and interviews that we will have. There will be the science aspect, and there will be a lot of discussion on the well-being of the doctor who needs to continue performing their work as a healthy doctor. And then there is an issue that I'd like to discuss, which is the existence of multiple guidelines. Here in the Middle East, we will follow guidelines from the United Kingdom and from North America. Some of these guidelines might conflict or contradict, and more recently we've been producing guidelines of our own. And sometimes we're faced with the challenge of which guideline to use in the lack of a structuring schema that governs the daily practice.